Okay, we're going to talk about the patient's Q angle. I want you to remember women have a greater Q angle than men. But nonetheless, Q stands for quadriceps, and you know the quadriceps are pulling on the patella, which is pulling on the patella tendon, which is pulling on the tibia, and that's how we walk. Now, if that angle is off, and here's where the angle comes. You find the patient's ASIS, and you're going to strike a line down to the patient's patella. Then you're going to strike a line from the patient's tibial tubercle right in the middle, and you're going to strike a line up. So when these two lines come together, one coming down from the ASIS down to the patella and from the tibia up through, they're going to form an angle somewhat like this. That angle should be under 15 degrees. If it's over 15 degrees, then you're going to have possible trouble with the patellar tracking. So that's something you want to look at. And if they have any problems with patellar tracking, oftentimes the vastus medialis gets involved with that. And some people, of course, divide that into the vastus medialis longus and obliquus. And you'll hear the vastus medialis obliquus may be weakened on that patient. Strengthening that may help to correct that process. A couple other tests for pain behind the knee or retropatellar pain would be, one of them is called Fouchet's test. So Fouchet's, what we're going to do is we're going to take our patient, let's just say our patient's having trouble on this side. In fact, you know what I'm going to do? I'm going to bring this up. Can I pull this up? And we're going to come down right on our patient's patella. So they have this retropatellar pain. They'll sometimes call that patellofemoral arthralgia. It can lead to things like chondromalacia patella, where you get these ulcerations on the back of the patella. And again, the Q angle, that's what you're looking for as well. But for Fouchet's, what we're going to do is we're just going to press down into the patient's knee like this and ask them if it causes them any discomfort. If it does not cause them discomfort, we're going to continue the pressure, but we're going to grind it back and forth to see if we can irritate it underneath there. If you're irritating it underneath there, then that is definitely something wrong retropatellar. Another test that we have here, we're going to look for our Ballottement test. Well, actually, let's do Clarke's test first. Clarke's, what we're going to do is we're going to take our patient's patella and we're going to displace it. We're just going to put a little patella baja in there just with our own pressure. And I'm going to move this down like this. After I push the patella down, I'm going to have the patient, I'm going to hold this. I'm not going to let it slide. I'm going to ask my patient to contract their quads and see if they can hold that contraction while I'm holding the patella down. And if they can, that's great. If they can't, and it's causing retropatellar pain, again, that could be caused by some type of retropatellar problem, like a chondromalacia patella. The next thing we're going to do is a Ballottement test and ask for a fusion behind the knee. Basically, we're going to, into this femoral pouch, so to speak, we're going to just milk down all the fluid that we can down in here. And if there's a fusion around the knee, when we push this patella in like this, you'll get these little click sounds, and then you'll watch the patella. It will be able to float back out at you. Again, something behind the knee causing the inflammation, bringing in that extra fluid.